Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with the weekly podcast of the Common Sense MD, trying to make something simple out of something that may appear more complex. You know, I'm always talking about nutrition, diet, hormones, all this. I'm always focusing on carbs and fats. I need to talk about protein, so I'm going to talk about protein today. You know, when you think about protein, and it's essential. You have to have proteins. You have to have fats. You don't need carbs, although they're nice to throw in. But anyway, when you think about protein, you think about muscles, don't you? You know, bodybuilders, etc. You know, you should also think about skin, hair, tendons, cartilage, hormones, enzymes. So it's more than just muscles. It's all these factors that you need proteins. Now, also think about your immune system. You need proteins for your immune system. Now, amino acids are the basic building blocks of proteins. That's very important to understand. Amino acids. Your body can make all but 9 of the 22 total amino acids. So you get these 9 from your diet. Your body can make the rest of them. So those 9 essential, the ones you can't make, amino acids, you get from your diet or supplementation. The essential amino acids, and I'll tell you which ones they are. They're histidine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan, and valine. Branched chain amino acids are 3 of them: isoleucine, leucine, and valine. You may have heard about bodybuilders taking branched chain amino acids before they work out, along with L-glutamine, which is actually pretty good. It turns out that these branched chain amino acids make up 1/3 of your muscle protein, so they're important. And they're different because they're broken down directly in your muscles rather than having to go through the liver. So they directly release energy into your muscles, and which means muscle growth and also muscle recovery. Recovery is as important as growth. Remember that. So, you know, they're always talking about when to take branched chain amino acids, and I think you should take them about 15 to 30 minutes before you work out. Same thing with L-glutamine. But there's another product I even like better than branched chains that seems to be absorbed better. And I'll tell you about that in a minute. But as we get older, we break down, obviously. You know, I'm experiencing some of that at age 67 for sure. Our muscles get weaker. Our tendons and ligaments break down a little bit. You know, I'm doing everything I can to prevent this. And there's a lot of stuff you can do, a ton of stuff. That's why we're here at Performance Medicine, to teach you how to grow older without feeling older. So with protein, of course, you need to lift weights. You need to build those muscles. And remember, muscle equals bone. Your bones are going to be weak if your muscles are weak. Also your brain. Lower hormone levels can occur when you have protein deficiency because it inhibits the creation of hormones. And I'm not just talking about testosterone, which is a main hormone for males and females, but growth hormone, thyroid, insulin, all very important. The other thing, too, is you get older, you get less able to digest your proteins, which leads to weak muscles and weak bones. And, you know, so many people are on these acid blockers, the PPIs, and that definitely affects your absorption of these proteins. So think about that. It also, if you don't get enough protein in your body, it leads to decreased neurotransmitters. Think about norepinephrine, dopamine, serotonin. So think about more depression, poor memory, sleep problems, maybe because of poor protein intake. So you need to start thinking about this. Also, your body's detoxification plant needs proteins. How much protein do you need? That's always the big question. Most experts say between 0.8 milligram per kilogram for just baseline longevity. And if you work out, if you're an athlete, you need anywhere from 1.5 to 2.5. Some bodybuilders will take more, but it's not exactly good for them. So, say a 170-pound man, that's 77 kilograms. So the baseline would be 77 milligrams per day of protein. As an athlete, I usually like to shoot for about 154. So anywhere between 100 and 150 a day is really good for me. That's what I try to shoot for. Now, important, proteins are different. Where do you get the protein? Your food and your supplements, like I said before. Now, remember, you think protein, you think about steaks or red meat. You think about eggs, you think about fish, nuts. Remember, when you eat a steak, it's broken down, digested into the amino acids, then has to be put back together. And some of it's utilized as protein, some of it's wasted. Some of it's converted to sugar and fat. But when I talk about protein waste, I'm talking about nitrogen balance. Have you ever heard about nitrogen balance? If you've ever been really sick in the ICU, you've heard about nitrogen balance. That's something that we really take seriously in somebody that's wasting away in the ICU and a lot of their other situations. But nitrogen is that element that's essential for all living things. It's what makes them organic. It's required for plants to make chlorophyll and then make DNA, RNA, and amino acids. So it's a requirement for life. Think organic plants. But nitrogen balance is something we can measure in a critically ill patient when it's necessary. You need to know if they're getting enough protein. And nitrogen is mostly in protein. Every 6 grams of protein has 1 gram of nitrogen in it. Now, I know I'm getting in the woods a little bit, but just bear with me a little bit. So nitrogen balance is responsible for, really, it represents the net result of protein anabolism, buildup or growth, and catabolism, which means the breakdown or loss of protein. And this is affected by the quality of the dietary protein and the energy balance that you're trying to maintain. Protein synthesis is affected by the anabolic hormones. Again, think insulin, growth hormone, IGF-1, which is a measure of your growth hormone in your blood, and testosterone. Growing kids and adolescents accumulate nitrogen, and thus they're in a positive nitrogen balance. Starving, immobilized, and severely ill people are in a negative nitrogen balance. They're breaking down their tissue proteins. And unlike fat and carbohydrates, the body does not have a mechanism for long-term storage of free amino acids. Instead, it liberates them from skeletal muscle. So this is complex but important because how much protein you accumulate and actually absorb depends on how much is utilized and how much is wasted. And that's why I went through all that nitrogen balance stuff that gets kind of complex. Try to make it simple. But so you have a spectrum of how much actually gets utilized and how much is wasted. At the low end are whey protein, nut, soy. And I don't like soy much. It turns out they're 80% wasted, 83% wasted, I believe. Meat, fish, and poultry are slightly better. They're just 68% wasted. Eggs are the winners. They're only 52% wasted. But a lot of people, can't eat eggs because they're allergic to them. Even the branched-chain amino acid supplements can be mostly wasted. You got to get the right mix for there. One that I found out that I've been taking is called Perfect Aminos. It comes in powders or capsules, and it kind of bypasses the digestive system, so it goes directly in. It turns out about 99% of it's absorbed. So for me, that's the best way. You still need to eat great, But especially if you're exercising, breaking down, getting older, I think these perfect aminos are really good for you. Could you take too much protein? Yeah, you could. Remember, it's stored as fat. And if you have a compromised kidney function, think hypertension or diabetes or obesity, then too much protein can further damage your kidneys. That's what some of the causes of nephrotic syndrome, when you're losing protein in your urine, proteinuria. That's why as an adult, you should get regular blood tests and probably urine tests to make sure what your kidneys are doing, especially if you're a diabetic, obese, or have hypertension. That's normal to have a little bit of small amount of protein in your urine if you do measure that, so don't freak out over that. But I'm a big proponent of routine lab testing. And for a really healthy young adult, maybe once a year. For most older adults like me, I get a Cleveland panel twice a year to keep an eye on all this stuff. So protein is important. You have to have it. How much do you need? Do you need 30% protein as a macronutrient in your diet? That's about what I take. It differs. People are different. Some people do better with a little more carbs than other people. Some people do more with more fat. I think most of your diet should be good fats, then proteins, and then carbs. But everybody's different. So you got to see how you feel and how you respond to these things. It's all individual. I always say the best diet you can have is one that you'll actually stick to and that you feel great on. So I hope this helps you think about protein in your diet. Don't just think about low carbs and high good fats. Think about good quality protein and how it's affecting how you feel, your energy levels, and how you grow your muscle, which is so important, especially as you age, and how you recover from workouts and just daily life. And all those other hormones and enzymes and neurotransmitters, they're all made from amino acids, which are the building blocks of protein. So something to think about, protein. This is Dr. Tom Rogers at Performance Medicine. I'll see you next week.